Beginning in March, King County took the unprecedented step of moving over 800 people out of congregate shelters and placing them in hotel and motel rooms. Early evidence suggests that this unplanned experiment has produced positive results that offers hope, not only for public health, but for improving the social and economic outcomes for vulnerable community members. A UW research team, in partnership with King County and a Gates Foundation grant, seeks to understand the impact of this resource-intensive intervention to inform future strategic responses to the homeless issues in King County.
All right, today we have the pleasure of talking to Gregg Colburn, Associate Professor at the University of Washington, and he is working on a grant. And so Gregg, start out, why don't you just tell us about yourself and what's your primary role at the UW?
Sure. Thanks, Jeff. I appreciate spending some time with you this afternoon. So I am in the Department of Real Estate at the University of Washington. I'm beginning my fourth year at the university. In my role, I have teaching responsibility in both our undergraduate and graduate programs, which I enjoy very much. And then, like all professors at the University of Washington, have a big focus on my research. My research tends to focus on housing broadly defined, and with a particular focus on people with limited financial resources, so low-income housing. And that can include analyses of housing affordability, housing markets, housing policies designed to support low-income households, and then homelessness as well is another big focus of my research. And the other thing that I spend a lot of time on is community engagement. And so I'm on a number of boards and committees within the Puget Sound region, generally thinking about housing and how do we deal with the shortage of housing units and the affordability problems that we have in our region. So that's how I spend most of my days in my role at the university.
And can you share more about the COVID economic recovery research grant that you're working on?
Sure. So I, as part of my work in the community, I spend a lot of time talking to both policymakers, people who are working at the county or city level government, philanthropists, all those who are engaged in those conversations. And I had some great conversations with King County over the last 6 months, thinking about what some of their needs are from a research perspective. And at the same time, I was spending a lot of time with the Gates Foundation, thinking about their work in homelessness in our region. And when the pandemic broke out, King County made the decision to move people out of congregate shelters, so emergency shelters where people would be sleeping on bunk beds pretty close to one another, which is, as we know, like an elder care facility, very, very high risk for the spread of the virus. And so the county made a substantial financial investment in moving folks out of those settings into hotel and motel rooms, where they would have their own bed and bathroom and importantly be distanced from other folks. And so when that happened, the community has been very interested in this intervention because it definitely proposes a different way to respond to homelessness rather than putting 200 people together in a congregate setting. There might be other ways to do that. Now, there may be costs associated with that. And so in connection with that, the county came and said, we would like to do a formal evaluation here because the early results suggested that this has been extremely successful, not only from the perspective of limiting the spread of COVID-19, it's also been really successful just in the life outcomes of these individuals. And what they've been able to do when they have their own bed, been able to sleep well, they don't have to worry about someone stealing their belongings at night, they have a shower, their personal hygiene is improved, their health is improved, their outlook is improved, and the service providers who are overseeing the shelters and the hotels have said they just can't believe the change in people. And so the county came to us and said, we would really like some help in doing kind of a systematic analysis of this intervention. And at that very time, the University of Washington Population Health Initiative came out with a proposal for a grant, a series of grants. I think they gave out 20, focused on economic recovery related to COVID-19, especially for vulnerable populations. And so I joined up with a colleague at the Evans School, Rachel File, and in partnership with King County, wrote a proposal to conduct both a quantitative and qualitative analysis of this intervention. We ultimately got that grant, which was great. We got some money from Urban at UW, which is a interdisciplinary initiative at the university thinking about urban issues. And then we got 25,000 from the Gates Foundation as well. And so with those three sources of funding, we were able to put a team together, including 2 graduate students from the university. And so we are in partnership with King County conducting quantitative analysis of employment outcomes, length of stay, a number of kind of homelessness measures based on all the people who have been moved into hotels and motels, as well as, and this will be really important, doing qualitative research. And so we're going to interview about 25 people who have been part of this intervention, as well as those who stayed behind in shelters that have been depopulated a bit, just to get a better sense of what their experiences have been. And the reason for this is we want to understand what elements of this were really successful so that we can inform future responses that the county or other jurisdictions make in terms of responding to homelessness.
Great. So what would be some measures of success you'd be looking for?
Yeah, well, I think some of them are going to be quantitative in measure. One might be just contraction of the virus. We're hoping to be able to get those data to demonstrate that this is in fact a healthier or a safer way to house people. But there might be other health measures such as mental health or physical health measures, trips to the emergency room, employment status. There might be interaction with other systems, whether it's criminal justice, emergency room, those types of visits. And so anecdotally, what we're seeing is on a lot of those measures, there have been pretty significant improvements. And so we just want to see if we can quantify that with the quantitative data. In the qualitative interviews, we also just want to get a sense for, hey, Jeff, you've been in a hotel now, you used to be in shelter, how is this changing? And what we're hearing is people have said, I'm actually taking up hobbies. Like I've started exercising. I never exercised before, right? Or I'm playing games with my colleagues and friends, right? And so they're developing hobbies. Their outlook on life has just changed because they're getting good. We all know what it's like to not get good rest, right? When you're tired, you're cranky. And if you do that in perpetuity, day after day after day after day, it's not surprising that people develop challenging mental health situations, right? And so what we're seeing is people starting to thrive when basic needs are met. And so, part of that will come through in the quantitative analysis, but I think a lot of the really rich information will come from interviews where people just talk about, boy, this has been really nice to have a bed and a shower.
Sure. No, I can understand that. So where are you at? What's the timeline in this and when does it get completed?
It's a good question. So one of the challenges with this is a time-limited intervention. And so the county just announced relatively recently that the leases are going to expire at the end of August. And so they started in March and April when the pandemic broke. And so they're still trying to figure out what they're going to do with everyone come August 31st, because there are financial limitations that prevent them from doing this for a longer period of time. But we also know that the virus is likely not going to disappear on August 31st. And so we are moving very quickly to make sure that we can interview and interact with folks before they exit the motel and hotel settings at the end of August. So we just got IRB approval this week, and so we'll begin interviews hopefully next week, and over the next 4 weeks, we'll conduct most of our interviews, and then we'll be doing analysis of that data after the fact. Our hope is to be able to deliver a preliminary report to the county in September. So it's from a traditional academic research standpoint, it's a pretty quick time frame.
Yes. And so when you're completed with this, where can other cities or where can the county go with it from there?
Well, I think we need to see what we learn. And I think the hope is that as the county thinks about longer term responses, and it's not just frankly on the county, it's incumbent upon all of us. I know the philanthropy community is very interested in this as well, because as we think about other ways to respond to homelessness, understanding what elements of this were successful could help inform what we do in the future. And so maybe we find that individual bed with 4 walls is really important. Maybe we find out that private bathroom facilities are incredibly important, right? And so we don't really know what it's going to be, but our hope is that when we put this together and understand what's really important, that some of those elements could be included in future proposals. The challenge, what I think is so interesting about this is, one, it's a response to a virus, it's a public health threat. But it also has given us a unique opportunity to basically do something that if you'd said 6 months ago, let's move people experiencing homelessness into hotels, everyone said there's no way we can do it, right? Actually, there is. We just did it. We did it because we had to, but it opens up an interesting question of why can't we do this all the time? Now, maybe hotels is not the most efficient way to do that, but we came up with the money, and Seattle's still running. King County's still running. It didn't bankrupt us. And so I think it's for someone like me who's really interested in the longer term response here, it allows us to have conversations that we wouldn't have had before, because we just would have said that that's not feasible, it's not responsible, it's not good policy. We did it. Okay, why can't we keep doing it? Why can't we do something that's a little different, maybe not as expensive, but it's not moving people back into shelter conditions that in many cases are not. I've been in a number of shelters, and it's not a pleasant experience. I haven't slept there overnight, but it's not a place I'd want to spend the night.
Sure, understandable. So how can we follow your work from here, or where do we look at, or where will we find out the results?
Yeah, so the report to King County, I believe, will be public, or at least some format of that will be public on the county's website, which I can share with you. But then our research team will also be taking these findings and seeking to publish them in an academic journal that's focused on housing. And so that will likely happen later in this year, early next year, when something like that would be published. And so there should be 2 potential venues for people to be able to see the results of this particular study.
Great. Well, maybe we'll be able to follow up with you this fall or next year, and you can tell us more about it. And when something comes out, we'll link it to this.
Fantastic. Would be happy to do so.